of weeks ago, we actually talked about that. We're going to be discussing today what specific value can I offer as a medical biller. And this is actually a testimony of that we hear from our audience. So we want you, as you'll go through today, to make sure that you type in some questions, and I'll get to that in just a quick moment. But again, first of all, let me introduce who I am. My name is Eric. I'm the Director of Research and Development here at American Business Systems, and certainly want to welcome you here this afternoon. For those that have been on our webinars once before, you can tell that we're going to ask the question about raising that hand there. That makes sure and ensures, at least to us, that our voices are coming through loud and clear. So if you don't mind, start raising your hands here on the side, and then I'll be able to start to see those hands go up. I see Sala, good to have you here. Rod, good to have you here. Michael, looks like we got some hands going up there. And it looks like Tony, if you're there, go ahead and raise your hand. Rosetta, you as well. Jason, Deanna, Benjamin, and it's good to have everybody here this afternoon. And you can see right here, we're just kind of circling our number just in case you need to talk with us. Well, now that we know that you're hearing from us, we want to hear from you. And so you'll see down here in your GoToMeeting webinar control panel, down here at the very bottom, there are places for you to type in a question. Patrick and I will take some time this afternoon to take as many questions as we can. Certainly, you may type your question in at any time during the webinar. And then if we just don't get your question answered today, be sure to type that in, because we will come back. Those of us that are ABS reps here will make sure that we get that question answered for you. So it's important for you to type in your questions, because we want to hear from you. That's the only way we know how we're supplying you what you need. Well, we want to talk about who we are here at American Business Systems right off the bat. And so I'm going to go on just real briefly of who we are, what we do, what you can find, how you can find out about us. Certainly here at American Business Systems, we have a suite of services that will help you help doctors across the country. There is a great need for people like yourself to get into what we call medical reimbursement specialists. And so it's just more than just being a medical biller. And hopefully you'll hear about that today, and why we want to stress today your particular value that you'll be able to deliver to the doctors. ABS is the nation's largest group of independent medical billers, and we've got folks in just about every state of the union, as you can see here. We are listed as a reference in the Entrepreneur Startup book. As you can see here, we've got a copy of this book here on the screen for you to see this, and you can see down here at the very bottom where it says business opportunities. There's books there, there's other websites that you can certainly look over, but whenever it comes down to business opportunities, we're really one of the only ones that are out there that can offer you the opportunity to do what we do here in medical billing. So you might want to check us out there. And for the past 20 years, we've been helping people just like you to do the things that you really want to do, and that's spend time with your family. As we get more and more pictures of our licensees with their family, we're actually showcasing one right there in the very middle, and that's the Catano family. They're able to build their business together as a family, attend the functions that they want to be able to do with their family, and that's what we've been doing really for the last 20 years. What are we doing in those last 20 years? Well, we have really honed in on our training. You can see here that we've got opportunities for you to have hands-on training with the computers, some time where you're working together in these workshops, and you hear from Patrick. It's not many times that you have a CEO of a company actually come in and teach and spend some time during these training classes, but Patrick does. And so also, not only do you get to hear from Patrick and all the other staff here at ABS, but here we have one of our licensees, Cynthia Anderson, who's just now recently been gone through some new training. She has become, I'm going to hopefully get this right, certified physician's practice management guru. That's the best way to put it. Cynthia's been a licensee of ours for the past 5 or 6 years. She has not only built one time, she's also built a business twice. And she's a great resource for us here at ABS in our training. But what are we teaching you? Well, we're actually teaching you the iClaim and the EMR system. This is a web-based system that we'll take our time to go over with you step by step and showing you again how to use what you're seeing on the screen right now as value add to these doctors. And again, that's our main focus today. As you can see right up at the top, we're asking the question, what value do you provide? Hopefully today that's what we're going to be able to share with you. For those that are first timers on our webinar, we want to make sure that you've gone out and done some research. So now I'd like to kind of help navigate you on what you can find as part of your due diligence. Certainly the first place to stop is our website at avsystems.com. You can click on any of the links about us, about the business package, the income potential, the news, but as you want to go deeper into learning about medical billing, especially with us here at ABS, you want to click those buttons right there where it says Get Started Here. And that's going to take you into what's called our virtual brochure. And our virtual brochure is a very deep, in-depth, step-by-step, self-paced with both what you can see here on the screen, things that you can read, but also some videos that you can watch. And then if you'll pay close attention at the end of each one of these sections, there's someone, an ABS licensee, that you can touch base with and actually speak with those folks. Another way to find out more about us is to follow us on Twitter at AB Systems. So Adam Phillips, our president of our company, does a wonderful job of keeping up information about American Business Systems on Twitter. And what you'll find there is really some things where we want to actually drive you to, like our YouTube channel. So you could actually go to youtube.com/YABS, and there you'll see several videos, past webinars, all different types of videos, especially from some recent training classes that we've got posted up there. So go check us out there. So you've got the website, you've got the virtual brochure, you've got Twitter. You can follow us there. You can also follow us here on YouTube. People ask us about what our rating is with the Better Business Bureau, and again, we've been able to happily maintain an A+ rating, so you can go check us out. You can see that it's for the Fort Worth area that serves the Tarrant, Johnson County, all the areas that are surrounding up here in this particular area, and that's where we're located. Really where we're located is just north of Fort Worth in a little community called Keller, and we are certainly welcoming you and inviting you to come by and visit us. I know that there in a couple of weeks we're going to have at least one of our folks that's looking to get into this business come by and visit with us, so you're more than welcome to come by. Just get the phone number that we'll give you here at the end. Give us a call. We'll certainly arrange the meeting so you can come. Folks, we just ended just last week with one of the best training classes that I can ever remember. It's a superb class of people. People are ready to go out there. And then soon you'll get to see their video testimonials as well, very soon. But our next one that's coming up is May 19th through the 23rd, and that is just a few weeks away. As you think about it, we're right here in the middle of April right now, get into the May season right there. We're going to be finishing that up, and there won't be any more training until actually after July the 4th. So if you're really looking to get into one of our classes, you might want to consider coming into us here in May. I'd like to introduce you to our founder and CEO of American Business Systems. That's Patrick Phillips. Patrick is an author. He's written several books. The two that I'm showcasing right now is one, How to Reprogram Yourself for Success, and the other one is Cash Crunch to Cash Flow. It is one of our marketing tools that you actually get to have as part of your marketing here in this particular business. He is also one of the features authors and speakers for BC Magazine, or BC Advantage, which is Billing and Coding Advantage Magazine, one of the nation's largest magazines out there for billing and coding. And you can see this is the actual latest article that he's written for the April-May 2014, How the Affordable Care Act Will Help Your Billing Business Thrive. So again, if you want to get a copy of that, get in touch with us. We'd love to be able to share that with you. But really, without any more further ado, let me bring Patrick on. Patrick, good to have you here. What a great topic today. We're going to discuss about value of this particular business.
Yeah, we get that question a lot from people looking into our business, don't we, Eric?
We do. We get that question asked, I guess, in several different ways, but we actually got this question very specifically asked to us on, I think, not too recently from a past webinar.
Yeah, and it's important that people realize when you go out in the marketplace with any business that you do have an advantage over other medical billers that are in your area, because there are companies out there that are doing the billing now for doctors in your area. So this is a great topic for you to zero in on and see what is it that I'm going to be offering that can really give some value to a doctor to make them want to do business with me and outsource their billing to me.
Yeah, absolutely. I think what I'd like to start off with here, Patrick, is let's just take a temperature of what's going on really out there with these doctors. And Adam sent us this article today. As you can see here, this is actually April 14th, 2014, about how being a doctor became the most miserable profession out there. I mean,
Who would have
whenever you
thought?
sent that to me, I thought, oh my goodness, this is scary looking.
Yeah, kind of creepy. But I think it's important that people realize that doctors are unhappy with their situation right now, and it's not all about the Affordable Care Act. It's
Right.
not all about the new codes that are coming down the line, electronic health records. It's just that in general, they are not a happy group of people.
Right. Yeah, and here's one of the, how they do their web articles now. They'll put the article up there and then they'll kind of showcase a little portion of that. And I wanted to bring this out. And it said here, Patrick, right in the middle of this article, to make ends meet, the physicians have had to increase the number of patients they see. The end result is that the average face-to-face clinic visit lasts about 12 minutes.
It seemed like it lasts about 2 minutes to me.
It does, but that's the time that the doctor actually gets in there. So what they're trying to do is generate what more cash flow, and they think the
Right.
best way to do it, I got to see more patients, and this
Yeah.
just begins a bottleneck right here at the beginning.
And as a medical biller, folks, you can actually help with this situation. You can help doctors. They don't have to see more patients. What they can do is spend more time with the patients they are seeing. And because you're going to help them with their coding to get the coding right through our system, because you're going to be able to get their money faster and their rejection rate lowered, that's going to bring more cash flow into them.
Exactly, exactly. So again, as Patrick's saying, it's not necessarily that the doctor has to see more patients right now. What we got to do is the patients that they're seeing, just get them paid on those. That's
Yeah,
the problem.
that's right.
Uh, because as we'll see here, we'll hopefully identify the issues that the doctors face, the solutions that we have through iClaim and EMRX. And I see there's some questions already coming in about the EMR and maybe how to switch those doctors over. So Solid, we'll get to your questions here in just a moment because we're going to talk exactly about that. Now, Patrick, here is outside of what value do you as a medical billing company provide? This has got to be probably number two or number one on the question. What about doctors leaving their solo practice and going out to be employed by hospitals? Here's an article you can see here written March the 18th, just a few weeks ago, 2014. Let's discuss this real quickly.
We've heard this for the past at least what year and a half, Eric,
Yeah.
that doctors are leaving their practices, and some of them are obviously being bought up by the big hospitals and other big medical groups that want to gather all the doctors under their oversight. But that's just the problem, right? The doctors actually become employees of those hospitals and organizations, give up all their patients, even if some of them are finding out, Eric, as they go back into private practice because they didn't like that situation, that those patients are not theirs anymore. So it's a
Right.
huge problem.
Well, here's the I think what they took out of this article, and again, folks, all we did was do some screen captures on these. You can see the reference that we have there at the bottom of the page here, so you can go look at that yourself. But Patrick, here are the biggest three areas, and I swear to you, you could have written this. We could have both written this by just past webinars that we've done.
Yeah, we've been saying this for years.
Exactly. Number one, not dealing with the business of running a practice.
They
They're
do not like that part of their practice. Well, as
no,
you pointed out, Eric, in other webinars, they have two businesses that they run. They have the clinical side, seeing
right.
the patients, and then they have the business side, which is making sure that they make enough money to pay their staff, grow their practice, buy new equipment, and so forth.
Well, I like these numbers here because, Patrick, a lot of people will ask me, well, how many doctors would be interested even using me? Well, folks, you can see here out of this recent survey, out of 4,600 doctors, 58% of these doctors don't like dealing with their own business.
That's a huge portion of those doctors that just say, look, running the practice, the business side is what it's saying, is they just don't like that side of it. Well, how can you help with that? Well, you free them up from the worries of collecting the money that's due to them from the insurance companies and from the government. And you handle all that for them as the practice revenue manager. They then can focus on the side that they got trained in and that they love the most, which is helping patients to get well and stay well.
It's kind of like that article we were just looking at. The doctors think, well, all I need to do is see more patients. Well, that's not the answer. Well, in this situation, the doctors think, well, if I just go work for a hospital, well, folks, that's not the answer. Because
No,
again, as we kind of go through this, 45% said they don't like to handle insurance negotiations or billing. Wow, 45% of doctors don't like to handle billing.
yeah. And so that's why we see more and more doctors outsourcing their billing because folks, they do not like messing with that. That's not why they got into medicine. Even their office managers hate the fact that they have to deal with insurance companies and Medicare and so forth, trying to get the money out of them that the doctors already earned when he saw the patients.
Right. And then the last one is just the guarantee of steady income. Now, anybody wants a steady income, but if we, as an ABS licensee, if you think about it, here's part of your value right here. You can start helping doctors guarantee a steady income. And that's 42% of that 4,600 doctors right there.
Yeah, by evening out and managing the doctor's revenue cycle, they call it, that is going to help the doctor just, again, to focus on the thing that they want to focus on research, reading, updating themselves on all the latest things that are happening in the medicine world. That way, they don't have to focus on this side of the income. They have to make an income. Sorry, I wish the doctors could all just volunteer their work and help patients for nothing. But let's face it, they have to make a living themselves for them and their families. And they want that steady income just like you do. The problem is
Exactly.
they don't have a steady income because of all the ups and downs. Medicare changes its rules and regulations as to how it's going to pay. Insurance companies change all the time what they pay. So the doctors really never know from month to month, do they, Eric? What's coming in?
They really don't. And then in this same article, just underneath those 3 bullet points that I've shown here, it says this, Patrick, and I'm going to read up to those red lines.
All right.
It says on the flip side, most employment complaints related to physicians perceive loss of autonomy and control over their work lives. Why don't you read their quotes there, Patrick?
Yeah. So what they're saying is the administration functions like the mafia. I have, zero input into management decisions. So if a doctor's working for a hospital or a big group, they have no decision making. They're just employees. Basically, they punch in and they punch out, and they've got to see so many patients every few minutes, and they get paid a certain amount of money, and that's it. They're limited.
Yeah. So we get back to this part here again. The doctors are happiest in practicing and give them the greatest autonomy. I mean, that's what they want. So again, answering this question, Patrick, what value can an ABS licensee bring?
Here it is right there in blue. Doctors are happiest in practices that give them greater autonomy in structuring the clinical activities and high control over the pace and content of patient care. Notice, Eric, there's nothing there about the business side of their practice or the money side. They want to focus on patient care. And we want them to, right? That's what helps everybody
Exactly.
stay well or get well.
Exactly. And so, folks, we want you to, again, make sure that you go out, take down these websites, you go read them yourself. These are some of the key elements. So, Patrick, seeing these articles, because these are just a small sampling of what we hear, you hear, We all hear it at ABS. We hear this because we're fed in with all these different RSSs that through our emails and getting all this. So what is this telling us?
Well, here's what it really means, Eric. To the folks who are on this webinar who are looking at getting into the business of medical billing and helping doctors with their billing, they come along with a solution to a problem. And that's how you make money in any industry, right? You find a need and you fill it. Well, there's a huge need out there. We just showed it to you. The doctors are really worried about their income. They're worried about their practice, staying in practice, keeping up with all the changes and the rules and regulations. We, as a company, help our licensees to stay up to date on that kind of thing so you can help the doctors stay up to date. Therefore, they worry less, and you're the ones that can help.
Yeah, and so that really comes down to the question, and hopefully in the next 35 minutes that we've got going here, 30 minutes, because we're going to take some time for some Q&A. We're going to answer who can help. And here's a picture of one of our licensees. And Patrick, I believe putting licensees like we've got, like here with Dr. Sally Combest here and ABS, we can help them.
That's right. Sally is basically down in, I think this was in Dallas maybe, or San Antonio, I forget. Anyway, she was at a trade show. We teach you how to set up a trade show. We have a booth that we provide. You see it behind her there. We have all the literature and booklets and DVDs and so forth that you can give out. And we teach you how to help those doctors. In fact, that DVD that's showing there is sitting right there on the desk. You can barely see that, of course, but it's why doctors outsource their billing. This is 6 different doctors that volunteered to be on camera and tell us why they decided to outsource to one of our licensees. And guys, that's a marketing tool that you use. It's not branded with our company name on it. It's for you. So you're the one that helps the doctors, and of course, we give you the tools to do that.
Before we move off of this slide here, that Sally reached out to you Friday afternoon and was needing to get some help. I mean, it was actually late Friday afternoon, and I told you, hey, I'll give her a quick shout, and I called her and see what she needed and kind of help navigate her through a few things. And do you know that she got that doctor? Now, the doctor that she got is a cardiac surgeon. And she says
wow.
that she hasn't gotten paid in almost 2 months.
So the surgeon has not gotten paid in 2 months. Is that because she was doing her own billing?
Well, she had someone that she thought that was doing her billing. And so we were able to work with that particular surgeon, help answer some questions. And Sally, was able to secure that client right there. So, folks, it is truly from what you would say the lowest of the lows, which would be your family practitioners, all the way up to your surgeons. All across the board, doctors need help for getting that.
And you're the one that can provide that value for them if you've been trained by ABS. We have been doing this for 20 years, and we know what we're doing when we teach people to go out and start this business with no background whatsoever in the medical billing field. We had a class last week, as Eric told you at the beginning, filled with people from all over the country. Only 2 of them had any background at all in the medical field, and it wasn't the billing side. One of them was a nurse, for example. So we can teach you exactly what you need to provide that value for doctors through all of the services that we have available, as Eric's showing you there.
Yeah, and so we're going to tackle a couple of these. We're going to focus in on iClaim and EMRX. And before I go into this section here, let's address this with Sala, because I think this is an important question as we get into this portion about how do we provide the value. Patrick, we already know that there are a lot of doctors that have already adopted an EMR system or an EHR system. And let's break that down to what that is. That's electronic medical records. So the question's asked, Patrick, in my area, most doctors have already converted to an EMR system. How can we convince that doctor to use the ABS iClaim and EMRX integration with their billing system?
We have a great example of that, Eric. You and I actually spoke to a doctor here in the Dallas-Fort Worth area, a licensee who was, wanting to switch over, and they had already committed to, what was the amount of money that they'd already spent on that eClinical Works or whatever it was?
$6,400 already.
Yeah, and so they'd already invested that money when they saw the live demo that we do for doctors, for you as one of our licensees, he was just blown away, wasn't he? He said, it doesn't matter what I've spent. This is the only way that I would want to go, so that it's integrated completely with our iClaim practice management billing system. When they're
Right.
together like that, folks, you have a winning combination to get the doctor more money faster than ever before.
Right. And we're going to get into that here when we get to that certain area. But again, that's somewhat one of those lingering questions that people ask about, um, what happens if doctors are they already have an EMR system or they already have a billing system. So, well, again, folks, there are questions that are coming in, and we want to remind you again that you can take the opportunity to write out your questions. And Patrick, I believe this question may not have come in during a webinar, it may have come in after a webinar, but again, let's very now, from here on out, we're going to focus in on what specific values can I offer as a medical biller, and that's what we're going to start off with. So we've kind of broken it down in just to three areas to try to get to the value portion of it. So certainly we know we got to deal with the doctor's needs. Certainly we have the solutions, and then how does that create the value to the doctor? So that's kind of the step-by-step process that we're going to kind of work through here.
Yeah,
You want to add anything to this?
yeah, in any industry that's out there, folks, you always have to find out if there, first of all, is there a need in the marketplace for what you are providing? Well, obviously there is a need. The doctors are struggling right now. They don't want to mess with it themselves. We just saw some examples of that. Then you have to have the right solutions for that. You just can't go out and start your own medical billing business on your own and send out a letter that says, "Hey, I just opened a medical billing company. Do you need any help?" The
Right.
doctors don't respond to that anymore, do they, Eric?
No.
They used to.
No.
Now, back in the 80s and 90s, when my wife and I were building our medical billing practice here, we would find that it was fairly easy for the doctors to wrap their brain around what we were doing because it was billing. That's all we did. Now, as Eric has illustrated already here, we have a whole stack of different services that licensees can offer to provide those solutions to the doctor. And of
Yeah.
course, that all boils down to whether or not the way people make a decision is on value.
Exactly. So let's get started here. The first thing we're going to do is talk about the need. And I know that we've kind of gone into a little bit in past webinars, Patrick, talking about the practice analysis questionnaire. But there are some people on the webinar today, and some that will listen later on, who don't know anything about the practice analysis questionnaire. So let's take us through what this tool is.
Yeah, I developed this back in the early days of our practice here, like I said, trying to figure out how do I find out, first of all, is there really any kind of problem or pain inside the doctor's office? Well, folks, in today's world, you can't go out and sell anything to a doctor. They're too jaded by all the other people that are approaching them on various things. So, what we decided to do was to let them tell us whether they had a problem. And the way we did that was by developing this practice analysis questionnaire. Uh, Eric, it's actually gone to 3 pages now, and
Right.
it's enough questions for you to at least get a feel for whether that doctor's practice is really having a problem with their cash flow needs. And we'll show you some actual questions that are asked and answers that are given on that questionnaire. We teach you how to
Yeah.
go out, ask those questions. We run through it in our live training to make sure that you understand how that works and why we're asking the question, what answers you're likely to get. And here's a real live one that we've redacted here, of course, for privacy purposes.
Yeah, we're going to actually look at several of them. This is one that was, I think, submitted electronically, and we've got some others that are actually handwritten that we'll certainly go through here. Here's one that recently was done just back in December by one of our licensees, and here's just the first snapshot of what you're going to actually get. You're going to get, how many doctors are there? Where are they located? Basically how often are they open? And that's how we kind of get our numbers in the first place, Patrick. When people ask us, well, how much money can I make? Well, we want to find out, are they open 5 days a week? Are they open are they open on Saturday and Sundays? How many
Right.
providers are there? And how many patients are they actually seeing? Then it gets down to, do you outsource? And in this particular doctor's office, they do outsource. We've redacted the company name there, but you can see there they do it at 6%. And I think, Patrick, a lot of people ask us, where is that? What am I going to have to charge the doctor? Well, here's clearly showing you in basically real time that another company that this doctor outsourced to, is charging them 6%.
Now, here's an interesting question that people should be asking themselves. Okay, we're looking at an actual practice analysis that one of your licensees did, and they are saying that they were already outsourcing. So, how did the licensee even get the time from the office manager? Usually, that's who this is done with, to get this information if they're already outsourcing. What does that tell you? It tells you that they probably weren't happy with their current outsourced biller.
Right.
And 6% is, I would say, Eric, pretty close to it's probably average, really. We've seen licensees down at 5%. We've had licensees charge up to 8%. So it's right there close to the middle. Well, that's a good indication that the doctors are willing to pay. This doctor was already paying something. They just weren't happy, as we'll see from some of the answers to some of their questions here.
Well, look, I'm going to look at the bottom question of this one. The question that we have in the analysis is, how do you get your claims from your office to your
somebody runs over in their sneakers and grabs it from them. It sounds like a courier, right?
A courier from their office. Again, folks, we have that solved with, first of all, iClaim, and if we can get them on the EMRX portion of it, there's not even a need for that.
No paper at all.
Yeah. And then then we have other solutions to go through it as well. All right, so we pick it up right here. This is the same report. I just kind of brought it down so we can snapshot this through there. And as we get down through here, it kind of tells a little bit what kind of system are they using and some other things there. And then this one is very interesting because this question on this one is, how much are they spending on software alone? Now this has nothing to do with the percentage.
Right.
So
this is over and above what they were paying the billing company. They were paying $3,000 a month, folks, for the software, and that probably includes some upgrades to the software and so forth. It's very expensive. Most of the software that's out there that most medical billers use, or that the practice uses themselves inside their own office, is very expensive. I don't know why, but they've always been able to get a lot of money for medical software from doctors, and that $3,000 a month is probably about average.
Yeah, and then let's see, 1, 2, 3, 4, 5, 6, 7 questions down. It talks about, is there money spent on a per user? And there is on top of the 6% of the reimbursement, on top of what it costs them per month to use. Then there's a per user.
$125 per user. That means if they have, I don't know, 3, 4, 5 people in the office, you can multiply that 125 by that and add that on top of the 3,000 and on top of the 6%. Well, folks, you can do that for much, much less because you're just not going to have those kinds of fees. With our iClaim billing system, for example, and the EHR, it's unlimited numbers of users that can be in the system all at the same time, including you and your staff and anybody from the doctor's office that you give access to the system. So we eliminate a lot of that. Look at this. This is what shocked me, Eric. $1 million a month is what they're billing to the insurance companies, and yet they're only getting collecting, it says $350,000 a month. Now, how could they possibly think that that's normal or anywhere close to what it should be?
Our
licensees are getting sometimes up to 85 and 90% of all the money that's billed.
Right.
It's just incredible that they're happy. Well, that's probably why they had them come in and do this analysis. Obviously, they weren't happy with that $350,000.
And this is from that same report. This one's $5,000 a month, and this is even with an EHR that's kind of recognizable, NextGen.
Yeah, and look at the updates on that software annually, $45,000. And do you have a user fee? Yes. In addition to that. Just incredible.
Yeah,
folks, you're going to see that you don't have anywhere close to those kinds of numbers that your doctors will be paying for access to our system, to your system. When you're doing the billing for them, for example, I just talked to a licensee, Eric, who wraps that all into the percentage. They don't have any fees whatsoever on top of the percentage. they're getting,
Right.
about 7.5%.
Right. Well, as you can see, this is another one, and this will be one of our last examples. But you can see up here, this is dated January of 2014, and this next slide's actually I expanded this out because that's what is the interesting part of it.
Oh yeah, this is about what you're not happy with. Yeah.
Right.
And she says, I'm frustrated. She believes that money is missing. This is the office manager. She believes money is missing, but has no way to find out. In other words, this whatever system they're using and whatever medical biller that they're outsourcing this to now, she thinks that there's money missing. I don't know what they would be doing with that money or where it could be going, but all kinds of things happen out there. You never know.
Yeah. So again, we've given you an example of what the questionnaire does. There's a question that's actually come in, Patrick. If you can kind of help me read this question here from Tarek about the analysis, and the question is, what is the analysis capability? I believe of iClaim is it all canned reports? Can it be customized, and can provider query the data to look at it in a way he or she wants?
Yeah, Eric, it's amazing. We've shown on other webinars, of course, some screenshots of the software. And of course, if people want to see an actual live demo, you can actually show some of that within that demo. But folks, you're going to be blown away, just like the doctors are, at all the data that they have access to. Remember, that's up to you as the medical billing company as to how much access you want to give the doctor and or their staff to certain parts of the system. You have complete control over that as the administrator of the system. But once they do have that access, they can see pie charts and bar charts and all kinds of data. If the doctors are number crazy, they're going to really love our system, aren't they, Eric?
They are. And Tarek, I think maybe what you might be inquiring about is in iClaim, there are some analytics, and we're going to talk about that just briefly. But so now, Patrick, we've got this information, and certainly what we do with this information, we take it and provide a report that gets generated back to the doctor of basically a comparison where you are currently with your billing. This is how much you're making. Here's the projections of what you would do with us, and this is how we're going to do it. And this is where we start to produce the solutions. And the two main solutions that get provided to the doctor are going to be iClaim and EMRX.
Right. This is 2 of 7 different services that you'll be able to offer to doctors. They happen to be the most, I would say, the most profitable. Eric, this is where most of the cash flow is in doing the billing for the doctor through the iClaim billing system and giving them access to an electronic medical record system like EMRX. Again, totally integrated, same company, same programmers, all together in one system. And look at all the advantages here Eric has come up with here. Here's the iClaim value that you're going to give to the doctor. Claims are paid faster. Eric, give us an example of that. What's the average out there? Some doctors are waiting for their money.
Wow, I actually talked with a doctor this last week who is an OBGYN doc, and she mentioned to me that I think it was taking her 20 to 30 days on getting paid. And then whenever I explained to her through the demo that I was giving that we could get them normally paid through iClaim within 7 to 10 days. She like almost like the phone dropped on the other end. I said, "You were there?" She goes, "Yeah." She goes, "I'd be astounded if I could get paid in the same month that I actually saw the patient." Those were her words.
Yeah, and we have had licensees come to us and say, you know what, I billed for a particular claim for a doctor on Monday, and the doctor had that money in their bank account on Friday of that same week.
Right. So when we're talking about claims paid faster, there is a key element there. We don't have it listed here today, and we've done this on other webinars, so go check out our other webinars. And that is because we own our own clearinghouse, and that gives us the capability to actually do and get those claims paid faster.
Yeah, now Eric, oh, I'm sorry, go ahead.
No,
You're on a roll there.
Yeah, I was just going to say, one of the reasons that our own clearinghouse gives us is this real-time access to the claims.
Yeah, so let me explain for those of you who are just now looking into how medical billing works. With most software systems, they have nothing to do with the clearinghouse. The clearinghouse is a separate company that's all they do is they look at the data, they sort it different ways so that different insurance companies get it sent to them electronically in different formats, and they scrub it. They do check for errors and things like that once it gets to the clearinghouse. With our software, most of that scrubbing is done within the system since we're online live in what's called real time between you and us. We're looking at that data and know in some cases whether you should even be able to submit it through us to our clearinghouse. It doesn't even go anywhere without correcting some errors. So it'll stop and say, hey, you left off this or you missed this, you have one digit missing. It'll correct all that as you're using it in real time. With other systems and other software and companies that are out there, folks, you're going to basically put all that together. It batches it. And then at one point at the end of the day, you upload that in a batch to the clearinghouse. Now the clearinghouse is going to look at it, take a day or two, sometimes 2 or 3 days, before they even get back to you a report as to what was wrong and what was right. In ours, it's all happening in real time. How can we explain real time, Eric? You and I are in real time right now, right? This is live. We're actually producing this, broadcasting it. Now, those of you who are watching the recording, you're not getting to see our smiling faces here on video, but we have a live video feed right above the slides that you're looking at right now. This is real time. It's happening just as you see it. Well, that's what happens with our system. The data that's sent directly to us is going straight into our system in real time, and we know instantly whether or not there are problems that need to be corrected.
The other, and kind of going back to what Tarek was asking about, is about the analytics. And Tarek, this is where, we're kind of, again, we're talking about value here. And in our system, these analytics are actually built in. Now, again, we can show this to you on a demo. What we're talking about here is, let's just say real quickly that we got a doctor signed up. One of the things that we would tell that doctor is this: give us about 6 months, get data into the system, and then about 6 months from now, we're going to be able to pull analytics. And what that means is we're going to be able to see where there may be some money that might be missing and what we could do to change that and gain more information here. And again, being, having our own clearinghouse, the real-time access to everything, and then real feedback analytics-wise, this is certainly a huge value that we can deliver to the doctors. Plus, it's web-based. Patrick, I think I mentioned to you earlier that I was talking with another doctor this week, who asked, if I go out on vacation or I do something, would I have access to my billing or EMR system from there?
Yeah, he could be on a cruise ship, and they even have rooms that you can go to and rent some time on the computer and log in to a system from there. Because, folks, it really doesn't take anything. There's no software at all that resides on your computers or the doctor's computers. This is all done right through any web browser that's out there, like Firefox, Safari, and so forth, Chrome. You just basically go to a particular website address. We give you the access codes to get in, password and all that. It's all HIPAA compliant, security, blah, blah, blah. And there, you're online, and you're actually looking at the live data that's stored on our servers safely in 2 or 3 different locations here in the United States. We've got a third one just about to open up, so when I say 2 or 3. So the great thing is, Eric, people don't have to worry about backups. They don't have to worry about theft. They don't have to worry about the HIPAA rules and regulations for patient privacy. We manage all that for them.
So imagine that everybody that's on the call today, imagine all of you are licensees. You've just done that practice analysis. You see where the gaps are. Now you can be able to take those issues and provide to the doctor. One of those may be that the claims, the rejection of their claims are high. Remember, that was one of the questions that was actually asked on that questionnaire, is what is your claims rejection rate?
Right.
A lot of doctors don't know. And so, again, ours keeps this in real time. We know. We know that if we're at 2%, 3%, 5%, we're really never above 2%, but we do know we can watch that. So, again, we're able to see that in real time. Now, that's about iClaim. Now,
wait, Eric. Let me just say this. Nationwide, we also know what Doctors don't know. They don't know their own rejection rate because they don't keep up with that. But we know from studies that have been done by the American Medical Association that the rejection rate is over 30%. I think it's 34. I think that's the number
34.
we saw. 34% of all claims sent in to insurance companies and Medicare are rejected. Now, do some of them get resubmitted? Yes, but not all of them. And sometimes the office manager is so busy producing new claims that day that they don't resubmit them, and then they're at a certain period of time, of course, they don't ever get paid, and the doctor has to write that off at the end of the year. They'd
Right.
rather have the money in their pocket, believe me.
Exactly. Now, turning over into the EMRX portion of it, now this is another portion of that practice analysis. They're going to have some questions very specifically about EMR. And again, one of the questions that we hear, Patrick, is how difficult it is with their current EMR system to either customize it, build templates, and do all of that. I like to put it this way. I think our EMRX is overbuilt. So instead of trying to build these templates, really all we're doing is kind of taking away and customizing it very specifically for the doctor.
Yeah, it's kind of like the proposals that we prepare for our licensees. They have all of our services listed in the proposal, but you can take out what you don't need. So to answer Salah's question earlier about that, it's easy customizable, and that's what some doctors don't like. Eric, the last figure I heard was 30% of all doctors with a current EHR are unhappy with it. That's a huge percentage that are unhappy after having spent maybe thousands of dollars to get it. Yeah. So when they see ours and how easily customizable it is to their specific needs, they absolutely go bonkers.
And even to Salah's credit here, I mean, he's certainly asking some great questions. But Patrick, what if the doctor wants to keep their EMR or their EHR? Because they've maybe spent up to $100,000 on it.
And they can if they want to. Sure.
We can connect. Okay.
Go Absolutely. Ahead. We have doctors and licensees all the time working within the system that they have, because some of that data can be transferred over into the billing side where you, as an ABS licensee, are actually handling the billing. So yes, it's totally possible to do that. The ideal, of course, is to have a doctor on our system. That's why the doctor I gave example earlier hadn't spent money on an EHR, but decided to go with ours and just write that money off, because they can see the value of getting more of their money faster, less rejection rate, and that was worth spending the time to get into ours.
Yeah, it's because it's 100% integrated with iClaim. I like, again, the way I like kind of describe it is the same people that work on iClaim or the same people that work on EMRX are the same people that work on our clearinghouse.
Right.
That's really brings it all together and gives us very simplified workflows here. And I'm telling you, Patrick, you wouldn't think about it, but there are still doctors doing paper super bills. But with the EMRX portion of it, there are no super bills to transmit.
No. And even if a doctor is using paper super bills, we have an online document management system called iDocs Now that will allow you to transfer all that information paperless from the doctor's office directly into your system on your computer.
Or I guess they could do what that other doctor was doing, which is use a courier.
Put somebody on a bicycle. Yeah.
Again, and again, accessible from anywhere. And again, since if they want to use their iPad and they don't want to have to take their big laptop and they're going to a conference, and it may be a specialty doctor that has to keep up with maybe kidney patients or dialysis patients or whatever that might be, they might need access to their medical records pretty quickly. Again, there's nothing to download. They just access it through an iPad or anything else like that. So those are some of
the doctors love those iPads, by the way, folks. When you put one in their hands that has our system running on it, it's like a child. It's just like a kid at a candy store. There's one on the flyer that we're illustrating there that is an iPad, and that's a perfect example of how that the doctor can access even his images that he's taken of the patient's leg or head or whatever right there, again, wirelessly from anywhere in the world. He could literally be at the public library. He could be in Europe. It doesn't matter, as long as they have an internet connection.
Exactly. That is the way to go. Okay, so now let's talk. We're going to talk about just two more cash flow issues, Patrick, because I know we're starting to run out of time here. Two of them that I want to bring up. One is choice pay. Now, this is another one of our services. Again, these issues will be identified in that practice analysis. And what we're talking about here is giving the opportunity for patients to pay without them having insurance, but a way to collect from them is choice pay. So this helps their cash flow. A little bit about this. So Patrick, why don't you go a little bit more about what choice pay is as a solution for these doctors?
Yeah, a lot of people don't realize what troubles doctors have of helping patients to pay their portion. I mean, sometimes people don't have insurance, they're self-pay, or they have to pay a big portion of a big bill. And so to manage that, doctors have to just send out invoices, statements every month to the patients and hope that they drop a check in the mail. Well, we know what happens to those bills, right, Eric? They get set aside, if not thrown in file 13, right? So we have a service that you can offer to the doctors that solves that problem and evens out that cash flow for the doctor, because the patient can now choose on their own to reduce their patient debt by different ways. They can have it drawn directly out of their bank account. They can put it on a credit card that's automatically debited each month. It's an automated payment system for the balances that patients owe. And of course, it increases the patient satisfaction because they don't have to worry about that. They don't deal with statements anymore. Some of you have everything paid, maybe your home house payment or electric bill automatically. Well, that's what this is for doctors' payments. Hey, this is a good statistic to know too, Eric. And we've got this on some of our other webinars, but according to the McKinsey & Company, they say that 50% of all patient balances are never collected.
Wow.
And with choice pay, we can increase that up to 98%. The doctors absolutely love this. They have their own patient portal that they can go into. The patients can just go in there, make the payments anytime they want to, or pay off the balance if they wish.
Pay it off. Yeah.
Yeah.
Exactly. And then one more that we'll talk about here is quick collect. Now, the first one with the one that we just showed you.
Choice pay, yeah.
Choice pay, thank you. Oh, boy, I just showed my age, didn't I?
It's been a long day, hasn't it?
All right, choice pay. But now, because that's trying to proactively collect the money. I think my mind was getting ahead of myself. This is what happens when doctors already have money owed to them. Certainly, we can't put those patients on the payment plan at that point, but we can certainly do this with quick collect on this end. So this is how to help collect from these patients and hopefully not even have to send these patients to collections.
Right, because this does it automatically. Folks, you're not in the collection business. This is an online system that automatically sends out letters to the patients reminding them that they owe the balances. It looks like it's coming from the doctor themselves, so it's not from you. It's not from a collection agency. This is much different. This is why our recovery rate, as Eric is showing there, is 2 times the average recovery that's out there. And we do that without making the patient mad at the doctor either. It's all web-based. It's a web-based system, of course, and of course it has detailed reporting that the doctor gets each month or anytime they log in as well.
Yeah, I believe from both sides of everything that we've shown right now about cash flow can all be put back into the iClaim system for accounting and make sure everything gets done there properly. But here's just a quick little snapshot of all the other services that you are able to provide. Again, due to time, we're running out. Can't go through each one of these, but we do have webinars that do talk about these others in a little bit more detail.
So on the screen there, we've covered iClaim and EMRX, and then below there, Quick Collect and Choice Pay. So you see those other 4, AutoCard, Audit Guard, CodeWrite, and iDocs. Now, that's all explained on our website through the virtual brochure. So if you haven't gone to the website, there it is at the bottom of the screen, absystems.com. Log in there by clicking on one of the orange buttons and go through that, and it'll explain each one of those services so you kind of get a better feel for that. We can't cover everything in one webinar, and we're only 6 minutes away, Eric.
That's right. Well, whether we like Warren Buffett or not, he certainly says this: price is what you pay, value is what you get.
I love that. Yeah.
Yeah. I mean,
you can go buy a new car and to pay a very, very small price, but look at the value you get versus one that's, two or three times that. It's true in everything that you buy in life. We're not always looking for the cheapest price that's out there, and neither are doctors, believe it or not. They want the best value, see, like Eric has beautifully illustrated here. If the perceived cost is lower than the perceived value, then of course you're going to invest. If I offered to sell you this iPhone here for $5, how many of you would send me the $5 immediately, right? Because you know that it's
Exactly.
worth more than $5. It's a no-brainer when doctors see the way you are going to be taught to present this to them. They will go, oh, well, I get it now.
So Patrick, why don't you kind of step us through here about this portion of it, about the billing system and how everything starts coming together here.
People sometimes ask us why we are able to be in business after 20 years doing this very same thing that we're doing today, Eric. And that's because we're the only company that I know of that has all four pieces of this puzzle put together. Let's start with the billing system, for example. We know that the billing system, I claim, is a very unique product out there in the marketplace. Not many systems have all the features and the leading cutting edge technology that I claim has. That's important that you have a good billing system, of course, when you're running a billing company, right? But then there's the EMR system. In today's world, you can't be a medical biller, folks, and not have some association with an electronic health record system. It just so happens that ABS already has put all that together for you. You don't have to make alliances with another company like one company we happen to know out on the West Coast. They will tell you that they have an EHR, but probe them about that, and you'll find out that all they do is just refer you to another company. We have it all built in. And then another third important piece, of course, is the clearinghouse. As Eric mentioned earlier, folks, we are the clearinghouse. We can't blame somebody else. It's like when something goes wrong with your PC. Okay, Dell made your PC, so you call Dell and they go, oh, well, that's an operating system. You have to call Microsoft, right? And Microsoft will tell you, no, that's a hardware problem. Call Dell. We can't do that. The buck stops here, right? We are the end result of everything, and that's why having the clearinghouse built in is so important. And then there's the people. Eric, the people that we have, the support that we give to people who are learning this business from scratch, and the ongoing support with their live demos, their practice analysis, the proposals, the pricing, all of that is invaluable. You cannot put a price, folks, on having the right team behind you. So with ABS, you're not in business by yourself. You're in business for yourself, but not by yourself. We are there, and all of the people behind us. Eric, I would say with our technology partners, we have over 150 people that are supporting our licensees right now.
Absolutely, and that's where your value that you perceive from us. This is how we're actually helping you. And then once all that comes together, you truly have the doctors reaching out their hands and saying, thank you, truly. And now, Patrick, you know this. We've actually had doctors just tell our licensees, thank you for helping. And here is, I want to demonstrate just real quickly one recently out of one of those, the practice analysis. The licensee went through all of this, and here's a signed contract of this from this year.
Yeah, and as you can see from this example, there's a setup fee there of $4,000. Eric, the licensee, probably made at least $3,000 of that, wouldn't you say?
Right.
Then you've got the percentage that they charge there. In this particular case, 6%. But I happen to know what type of provider this was and what kind of volume that brings to the licensee, and it was over $35,000 a year for that 6% there.
And they're charging the doctor $483 just to use the EMR system as well. So
right. Which there are fees for every electronic health record system out there has a monthly fee like that. This is just built in and is something that you pass on to the doctor that they're paying for. And Eric has even got the copy of the actual check there. Look at that. They got an installment fee on, this was a different contract, I think, but it's for $7,300. I can't read that number.
Yeah, I guess that one is for that one for $73.95 there. So yeah, we get these quite often just to kind of show you here, but really what we've demonstrated hopefully this afternoon is basically truly we can't just run out to the doctor and say, hey, you need my services. I'm the greatest medical billing company. We know the doctors are going to give a thumbs down. But once we're in front of those doctors, once you're able to use the practice analysis very properly, then associate that with I'm mean a rock solid proposal that goes along with, and I want to include this, a live demo for the doctor that is conducted by us, for you, for them.
Unheard of. That's just not done. There's no
Yeah.
company out there that will do that for their licensees. We're the only company that I know that does those live demos, and they're invaluable. Here's a quote from one of the doctors that have actually outsourced to one of our licensees. As you can see, she says, my billing was horribly tedious, very time consuming. When I outsourced my billing, I was able to get my headache away. I can track what's happening with each and every claim online 24/7 at my convenience. Here's another one. I love this guy's name, don't you?
Yeah.
This is a real doctor. I know he probably gets ribbed about that a lot. Johnny Walker. That's a liquor, I think. I'm not sure. In this day and age, he says, with all the complexities of medical billing, I can't imagine doing it any other way. That is, billing in-house at this point. A good physician has to decide when to delegate responsibility.
Now, folks, you can actually see these because this is part of that DVD that Patrick was talking about that was shown by that one of those licensees. And this last one here from Dr. Contanzio. There we go.
Catanzaro.
Okay.
Medical billing is very difficult unless you outsource. To do it in the office would take a lot more time and money. It's allowed me to get better reimbursement on my claims because I have an entire billing company behind me to check the claims and to follow up on them. They have a wonderful online system that allows us to check on the claims, update the patient information, and much more. And we got several others. We just didn't have time to put them all up there.
Yeah, we're just really out of time here, but we do have a few more minutes here. I think we're right at the top of 4 o'clock here. But there were only a few questions that actually came in through, and I believe we've got those tackled there. Patrick, as we kind of wrap this thing up here, if you do have a question that did not get answered today, go ahead and type it in now because we record those. We might not be able to answer them right now online during this as we kind of wrap things up here. But if you want to type them in, feel free to do that. They get logged in. We take them. We get those questions answered back to you. So hopefully, Patrick, we've been able to answer most of the questions. But really, let's answer the biggest question. What happens when I go to training, and you've talked about this in the past, about your 100% money-back guarantee? Why don't you take it from here?
Yeah, I try to mention this on every webinar, folks, because I know this would be important to me. If I were looking into a business like this and wanting to invest in that business, I would want to know, first of all, you're not going to get all the answers to everything. You can't. It's just impossible, no matter how much due diligence you have, because you can't even imagine what we really go through in that live training workshop here in Dallas. So if you go through our workshop and at the end of the workshop, you think for any reason, you know what? I've just decided, I don't like this. This is not for me. It's okay. Just ask. You get all your money back, 100% money back guarantee. And Eric, people have asked, how do we stay in business doing that? It's because nobody asks for a refund. But it's there. The money's kept in an attorney's trust fund, and it's not even touched by us as a company until that training is done and you are saying to us, I'm thrilled with what I've seen. And Eric, speaking of that, last week you got a few testimonials from the folks in the class on video, didn't you?
We got several, and I think the biggest one that I liked the best is whenever I was getting a testimony from one of the ladies, and folks will be able to see it here pretty soon. And she simply says, "This is not a rah-rah session." She expected it. She says, "I expected it, but it wasn't. It's real. It's real business. We talk about real issues, and I can't remember the rest of what I just remember she said it wasn't a rah-rah session."
Well, if people want rah-rah, I could give it to them, couldn't I, Eric? I've been a public speaker. I've written books on motivation and so forth and success. But folks, during this week, we focus on your business and how to get started and get your first client. That's the most important thing to us. We have nothing else to sell you. During this week, you won't hear us sell a thing. In fact, we give away a few things that you don't even know about when you get there. So there's no more sales pitches. At that point, we're serious. You've invested it with us. We're going to give you the value that we've been talking about, right? Value. Exactly. And you'll see that investment with us for our license fee is a very, very small perceived cost at that point.
All right. Well, I'm putting up the dates again. I'm actually typing those back in here for us to have up here on the
Yeah, and
screen.
there's the phone number at the bottom, folks. That's a toll-free phone number. You can call right now, and somebody will answer the phone and get you to the rep who actually sent you the email for this webinar. There.